Did you know that not all vaccines are administered by needle? Some are administered intranasally, like the flu shot.
Did you know that the CDC now recommends the pneumonia vaccine for adults over 50? And with the PCV20 and PCV21 formulations, most adults have a lifetime protection with just one dose.
Did you know that smallpox was completely eradicated by vaccines?
The CDC recommends a single dose of an FDA-licensed RSV vaccine for all adults ages 75 and older and adults ages 60 to 74 who are at an increased risk for severe RSV. There are 3 vaccines that are currently available, and eligible adults can get the RSV vaccine at any time, but the best time is in the late summer and early fall before RSV starts to spread in the community.
Myth or fact? The HPV vaccine is only recommended for girls that are aged 15 and older. This is a myth. The HPV vaccine is recommended for both boys and girls and can be started as young as 9 years old to help prevent against different HPV infections and cancers.
Did you know the flu shot doesn't actually give you the flu? It just elicits a strong immune response that means it's working.
Did you know that smallpox is the only disease that has been eradicated worldwide by vaccination? Currently, the CDC is working with partners to eradicate polio as well. The more you know.
Did you know that the Shingrix vaccine is a 2-dose series and is 90% more effective than the previous shingles vaccine that was out? Now you know.
Did you know that while vaccines are there to help to protect you, when you get vaccinated, you're also helping to protect others? The spread of disease will slow when a large portion of the community gets vaccinated. This in turn will help to protect those who could not be vaccinated, such as infants or those with compromised immune systems.
Contrary to what people may think, vaccines are not linked to autism.
Did you know that the first vaccine ever used on humans was the rabies vaccine? Developed by Louis Pasteur in 1885, it was successfully given to a 9-year-old boy who'd been bitten 14 times by a rabid dog, ultimately saving his life.
Did you know the pneumonia vaccine is now starting at age 50 instead of age 65?
A common question or concern that patients have is if infection-derived immunity is better for them than vaccine-acquired immunity. Infection-derived immunity requires a patient to experience exposure to a disease in order to gain immunity. Exposure to a disease comes with unpredictability. There may be long-term complications and different symptoms a patient may suffer from. Vaccine-acquired immunity has lower risks, higher reliability. It allows the patient and their healthcare provider to keep track of what the patient has already received immunity for. And ultimately, it is a way for the patient to safely gain immunity. If you still have questions or concerns about vaccines, or you're wondering what other vaccines you may be eligible to receive, make sure you talk to your local pharmacist and healthcare provider.